When it comes to patient autonomy and accommodations for deaf individuals, there are several important do's and don'ts to keep in mind. Don't rely on family members or untrained individuals for interpretation. Family members may not be familiar with medical terminology or may have their own biases and opinions, and untrained individuals may not be able to provide accurate interpretation. Don't assume that all deaf individuals use sign language. Not all deaf individuals use sign language, and it is important to ask the patient about their preferred mode of communication and to provide the necessary accommodations. Deaf individuals have the right to control their own healthcare decisions and to access the information and resources they need to make informed choices. Do respect the patient's preferred mode of communication. Some deaf individuals may prefer to use sign language, while others may prefer written communication or speech reading. It is important to respect the patient's preferred mode of communication and to provide the necessary accommodations to facilitate effective communication. Do provide qualified sign language interpreters when requested. Deaf individuals have the right to access accurate and complete information about their health and treatment options, and a sign language interpreter can help to facilitate communication and ensure understanding. Do use accessible materials and technologies. This can include providing written materials in large print or braille, using closed captioning or real-time captioning during virtual appointments, and using remote video interpreting services when in-person interpreters are not available. Do consider cultural differences. Deaf culture has its own unique traditions, values, and experiences, and it is important to be culturally sensitive and aware of these differences when working with deaf patients. Remember that providing the requested accommodation is imperative for the success of their health, regardless of the visit purpose, whether it's screening, procedures, well checks, sick visits, medication review, or other appointments. For most deaf people, ASL is their primary language, and for many, they have very limited proficiency in English, whether written or spoken. This means they're unable to communicate effectively without the use of an ASL interpreter. Thus, it is important to provide the accommodation of an ASL interpreter when requested. By following these do's and don'ts, healthcare providers can help to ensure that deaf individuals have equal access to healthcare services and to help support their autonomy and self-determination in their healthcare decisions. Now let's talk about getting a deaf patient's attention. First, the don'ts. Never physically try to move them around by grabbing their arm and pulling them around without permission. Don't stomp on the floor, bang on the table to get their attention, or flash the lights on and off when you're trying to get just one person's attention. Don't aggressively jab the person you want to talk to or wave your hand right in front of the person's face in close proximity. And definitely don't say it doesn't matter or it isn't a big deal if they didn't understand something. Do wave in the line of sight of the patient or lightly tap the patient. With an interpreter, don't talk directly to the interpreter. You're communicating with a deaf patient, so look at the patient when talking to them. And when the interpreter is talking back, continue to look at the patient. You may need to consciously train your brain not to look in the direction of the sound. Also, don't talk louder or slower. Do directly talk to your patient and make sure you have their attention before talking. The patient will need to be able to see the interpreter. Do maintain eye contact. ASL is a highly visual language. Don't look at your computer or fill out paperwork while talking or listening. This comes across as ignoring or just not listening to the patient. Do use normal lip movement and talk clearly and at a normal volume and pace. If the patient is lip reading, make sure the room is well lit. Do use written notes or diagrams to assist you if you're having difficulty explaining something. But remember that deaf people have different communication needs, so writing information down won't be helpful for everyone. If your patient doesn't understand you, try and think of a different way to explain yourself rather than repeating the same words again. Do use gestures and facial expressions to help explain yourself. Show with your face if something is painful, scary, or nothing to worry about. Do point to parts of your body if necessary. Do keep checking to make sure your patient understands you. If your patient doesn't understand you, try and think of a different way to explain yourself. Do have the interpreter stand behind the doctor instead of between, if possible. Still, you might encounter situations where you're waiting for an interpreter to show up, or at times when the VRI or video remote interpreting is not working and alternative accommodations are being arranged. Do let the deaf person take the lead on communication style before the interpreter arrives. Wait and see how they initiate or negotiate the communication. When writing back and forth with a deaf patient, be willing to write and give them all the same communication in writing that you would give them verbally. This includes full sentences and using proper grammar. Look at the person during the written communication and have patience to finish the communication. Let's review some important things to keep in mind when communicating with deaf and hard of hearing patients before an interpreter arrives. Ask the patient about their preferred mode of communication and make accommodations as needed, such as providing sign language interpretation or visual aids. When writing, give them all the same communication that you would give them verbally. This means writing in full sentences, allowing time to write, looking at the person during the written communication, and staying engaged during the process. It's important to give additional context. This can include gesturing while speaking, demonstrating any actions needed, wearing a clear mask to ensure the patient can see your mouth, and never turning away from the person while communicating with them. Provide visual aids such as written materials, diagrams, and gestures to supplement verbal communication. Communicate with eye contact first and then type up notes on the computer if possible. Because sign language is a visual language, it may feel like they are not being listened to if you're looking at something else. Do not assume the deaf or hard of hearing patients cannot communicate effectively or that they do not understand what is being said. Remember to show empathy and understanding for the challenges faced by deaf and hard of hearing patients, and respect their preferred mode of communication. Be patient and allow extra time for communication, especially when using sign language interpretation or other accommodations. Many deaf people may not have access to information regarding COVID-19 due to the lack of accessibility. Be patient with those who might have concerns about vaccines. Patience and clear communication can help ease patient worries. Clear communication requires accommodations, so be sure to ask and follow through with providing the patient's preferred communication, typically an ASL interpreter, a certified deaf interpreter, or video remote interpreting.